Crystal Brown has been battling sickle cell disease all of her life and says with hydroxyurea, her life has changed for the better.
Intense pain. My 20s and 30s were rough, and it wasn't until my late 20s, early 30s that I began to take the hydroxyurea.
Sickle cell disease is a group of inherited red blood cell disorders according to the Center for Disease Control. The disease causes the red blood cells to become hard and sticky and change to a C shape. Hydroxyurea is the only treatment for sickle cell disease that modifies the disease process according to the National Institutes of Health, the NIH.
You get a medication that essentially raises the hemoglobin F of the body, which acts as a protector in terms of preventing and reducing the chances of crisis episodes. It's proven to be very effective for a great many of our patients.
I used to tell my parents, I can feel this thing. I can feel that I'm better. You know what I mean? And of course, you gauge it by the crises that you have.
Hydroxyurea helps the red blood cells stay round and flexible, allowing them to travel more easily through the tiny blood vessels, according to St. Jude's. Take a look at the red blood cells of someone with sickle cell disease before taking the drug, and now look at the red blood cells after.
Okay, hydroxyurea is a medicine that helps children and adults with sickle cell disease. Recent studies show that taking hydroxyurea can help lower acute chest syndrome events, the number of pain crises, number of blood transfusions, and also the number of hospitalizations.
Research according to St. Jude's Children's Research Hospital shows hydroxyurea may also prevent damage to the spleen, kidneys, lungs, and brain.
She was so excited, and we were reading up on it. First thing that stayed in my mind was cancer patient. You know, this is what they're treating cancer patients with.
It was originally developed as a cancer agent. However, the notion that it could cause cancer, or rather the possibility of it causing cancer, is pretty remote. We haven't seen any incidents or any cases of anybody developing cancer in sickle cell patients, that is, since its advent.
And I remember initially a lot of nausea feeling. And then my skin broke out, my face, you know, just fine rash.
Some of the, I guess, complaints or concerns of some of the other patients I've heard from are hair loss, particularly the women. And from time to time, I hear some complaints about changes in the skin. I've heard about hypersensitivity, itching from some people. But generally, it's individuals who already have a pre-existing condition.
There are several short and long-term effects of taking hydroxyurea according to the National Institutes of Health. Short-term effects include a decrease in leukocyte, a decrease in platelet count, decrease in sperm count for men, dryness of skin, darkening of skin and nails. Long-term effects include birth defects in offspring.
It's been known to be birth defect inducing agent. So it's it's very important that they eliminate it in the event that they're attempting to get pregnant, or if we discover that they are pregnant.
Today, Krista received a good bill of health from her doctor and hopes that with hydroxyurea, she can continue to live a long, happy, and healthy life.
Because I had parents who didn't tell me no. You know, can I climb that tree? Sure. Can I swim? Sure. Can I ride a horse? Sure. My father was very instrumental in making sure that I had a regular childhood.